Hello,
Hi, how are you?
I'm fine. Good.
Good.
Thank you. You?
Uh, I'm good, thanks. My name is David. So pleasure to meet you. I met with, I believe, with Carla at the
Mm-hmm.
Prophet event,
Mm-hmm.
and she told me that there was a veterinarian. I'm assuming it's you. There's a veterinarian that was often using Leica. Okay, great.
So,
So
sí, dale las dos de Oxy ya cuando no se pueden no se pueden vender sueltas esas. No se pueden vender sueltas, esas pastillas se han quedado huérfanas. Pues entonces que cuando vengan, pues después le quitamos dos al blister. No. Es que les van a sobrar. Entonces que vengan después a por todas. Tienen que vengan después a por todas y tienen que venir a por el córtico. Sorry.
no problem, no problem. And no, so as we are doing some interviews with some of the veterinarians that are using Leica more often. Just trying to have them express how they are finding using Leica. Also, what advantages they are gaining in using Leica. Um, we are just collecting a few interviews that when we will kind of show maybe at some trade shows or some events. So if that's okay for you, it's just going to be a video ongoing maybe at our booth or something like that. So if that's not a problem, we are registering the call if that's okay for you.
No
Right.
problem.
So I've introduced myself. I would like you to introduce yourself, maybe introduce what you do, how your clinic operates, let's say how many people there are in your clinic, if that could be possible.
Mm-hmm. Yeah, okay, so I'm Silvia. I work as a vet in LidaVet. We are a clinic in Barcelona. We do a little bit of everything, general medicine. I'm also specialized in rehabilitation. We are 3 vets and 3 nurses. And what? That's it.
Perfect. And could I ask you, in general, what time during the day or the consultation in general do you often use Leica? Do you use Leica more before the consultation, after?
Both actually. So we usually have a little preview of what the consult is about in the appointment in our program. So when I already see that there's something that maybe I might need some help or I want to have some more information, I will usually talk to Laika. She's my best friend. And also afterwards, sometimes when I have doubts or when I get more information, I use a lot just to make sure that I am on the right path. Sometimes just to confirm that what I'm thinking is right, to see if there are other options to what I think that the differential diagnoses are. So that's more or less the use. So I use it both ways, previous and after the consultation,
Okay,
instinctively.
perfect. And before using Leica, were you using other tools of artificial intelligence?
No, just the internet, I guess. Uh, Maybe more books or
Okay.
asking colleagues. So
Mhm.
now I use a lot just to when you have a colleague and you already maybe know the answer or more or less, but you just like to ask to make sure to confirm, just like a mirror to show throw ideas at. So before I just wasn't as sure that everything that I was thinking was correct or not correct.
Okay. And regarding the advantages of Leica versus what you used to do before, so maybe asking a colleague or, for example, going proofreading some books or some manuals. Do do you think there are some advantages? And if so, which are the most visible advantages?
Definitely is faster than going on PubMed and looking for research. She can do it for you. Like if I talk about a case, then you can ask for like the references and go directly to those articles. So for me, it's the best thing is that it's faster and also more like directed. Sometimes it can be hard to find information about a particular subject on the internet, and she's like very on point.
Okay, perfect. And so going back to the consultation, so do you sometimes use Leica also during the consultation?
Yeah, sometimes
Okay.
when I have doubts, and I would usually just go out and
Mhm.
read books and look for information. Now I combine them both. So we still have the books of differential diagnosis and everything, but I sometimes use like doing consultations as well. Yeah.
Okay. I've met also, I remember I'm meeting Carla in the Prophet event, and I told her there was a new functionality. I don't know if you have tried it, the scribe functionality that records your consultation
Mhm.
during, that basically records the consultation with your patient and then the pet owner, and that gives you the whole um, summary of the consultation. I don't know if you have tried it
No,
yet.
we don't use it. No, no.
Oh, okay. Okay, perfect, perfect. One other thing I wanted to add, I know that you are also going on to Provet Cloud, if I'm not mistaken.
On two, sorry.
Provet Cloud, Provet
Yeah,
Cloud.
yeah.
See,
We're gonna do
uh,
the change. Yeah.
okay, okay. That would be great because we are also integrated into Provet Cloud.
That's amazing.
So yeah, let us know when you do the switch from your current practice management system to Provet, and we will let you know also how to activate the integration. So in general, I wanted also to ask you, what do you think of let me say, in general, artificial intelligence and the fear that some veterinarians or some pets owners have in artificial intelligence. Do you think that's justified? Do you think that's a bit too much? What do you think about that?
About the fear that there's about artificial intelligence. I just think that it needs to be used carefully and with a bit of like sense. Of course, you cannot trust everything that comes from Leica or any other intelligence. You just have to check again. But I don't see it as a threat. I think it's a for us, it's very helpful regarding like tutors using it, not specifically Leica, but maybe ChatGPT or any other ones. For me, they were doing it before asking Google. So it's not really a difference. It's just another tool that they use. And well, they are tools that when you do know how to use them and you have the knowledge behind it to like use it properly, then I think it's very useful. Well, that's why I use Leica so much. I like them, and it makes my daily practice and work easier, and it makes me feel more sure about my work.
Okay. Okay, perfect, perfect. Yeah, no, I actually agree on many of your points. It's actually the way we, are trying to market the service that we offer as, we obviously don't want to lean into the fear of some veterinarians, but at the same time, we also want them to, make them their own decisions. So I think the way in general, how you are using it and the way you are using it is probably, the way we kind of envision a veterinarian utilizing Leica. I'm not sure. Do we have any more questions? I'm looking also because there's Francesco with me. Yeah, puoi anche dire a volte, perché non vedo niente. Ok. Ah, ok. Okay. So yeah, there's just another colleague with me in the room. So so is there also some in general particular example of cases that you remember having solved with LAIKA or with the let's say help of LAIKA, something that maybe is struck in your mind or some complex case that you remember?
Mm, I don't know. Well, right now I was just with a patient right before we had the meeting, and it's a patient that I am suspecting that has Cushing disease, but is presenting symptoms as well of maybe diabetes, just high glucose and glucosuria. Um, so I knew that there could be a relationship in between both of them, but I talked to Laika, or I explained the case and I expressed what I thought, and she helped me confirm that there are some of the symptoms of diabetes that can happen and occur in Cushing disease, how it happens, why, just a lot of information that you have going around and that you know that is related, but I don't know, we need to know about so many things that sometimes you can't. And so she helped me with that, just to see that probably my suspicion of Cushing was right and that the symptoms that were appearing on the other side could be explained. So it's not a resolution of a case, but she just helped me to see how everything was interconnected.
Okay, that's great. Yeah, to get the links between you know the parameters to get you know to make links. It's yeah, for artificial intelligence is here for. I wanted to ask, does your clinic also do some referrals to other clinics by any chance?
If we refer animals to other clinics,
Yeah.
yeah. Sometimes we do refer animals to bigger hospitals in Barcelona and so on.
Okay. And has it ever happened that utilizing LAIKA, for example, you managed to not use a referral or to save something on an external consultation, something similar? Has that ever happened?
I don't think so. No.
Okay, right. And have you ever spoken about in general LAIKA with some of your colleagues or not only in your clinic, maybe other colleagues, other veterinarians that you know of?
Yeah, I think so. I think I've mentioned her. Yeah.
Okay, perfect.
Mhm.
Thanks for doing that. And vedi le consultazioni specialisti, adesso lo abbiamo chiesto ora. Not sure if we have any other questions from the room. I'm looking at my colleagues.
Perfect.
Right. Yeah. Yeah. Obviously, this was my last question that I was keeping for myself. But is there something that you would like to improve? So see as an improvement in LAIKA?
Not really so far. The only thing that I more often see that is maybe not accurate. I don't know if it's because there's difference in between countries or systems, but doses of
Ah,
drugs sometimes are different to the ones that we at least use here. I always check, and most of the times they are similar, but sometimes it's different.
okay. Yeah, we have been doing massive import of dosage queries onto the artificial intelligence, both the one specifics for animals and also you know off-label dosages as well. Obviously, there's a lot still to be
Mhm.
imported. Yeah, and do you utilize mostly the generic chats, or do you usually add a patient onto LAIKA?
I usually do the generic chat when I
Okay.
do have a patient that is a complicated case and that I know that is gonna be coming. Then I do create the patient, but normally I use the
Mhm.
generic chat.
Okay, perfect, perfect. And one last thing, we are also, I also wanted to tell you, we are also developing a new product. So it's something still using artificial intelligence to help clinics. And we are still in the very early stage of development phase. It's obviously going to be um, let's say, attached to what LAIKA is doing, but it will have also other functionalities. I don't want to spoiler too much about it, but we are organizing some interviews with some veterinarians. We have done in the past with some of our users. As we are in the development phase, we are also going to interview a few veterinarians. I wanted to ask if you were available, not maybe in a couple of weeks' time, etc., to kind of have a look at this product and see what you think about it. If it's something that maybe in the clinic can be used in general, just as a veterinarian, not necessarily as a customer, etc.
Mm-hmm.
Just purely because we try to get unbiased feedbacks
Yeah,
from what could be our potential customers, and that would be great. As
totally. Yeah,
great.
good.
Thank you very much, then,
Thank you.
Sylvia, for your time. It's been a pleasure meeting you, and also say hello to Carla.
Okay, I will.
And yeah, I'll let you know if we need your help also for this other interview. And yeah, thanks for using Leica again, and
Perfect.
I will yeah, and we'll speak to you soon then.
Good. Thank you very much.